Squirmy and Grubs. This is a very popular YouTube channel with about 1 million subscribers about an interabled couple, Sean and Hannah. Sean has spinal muscular atrophy and Hannah has no disability, in fact was a former competitive swimmer, and I'm going to talk about their channel and Sean's disease from the perspective of a neurologist. So they have a blog style channel where they talk about their relationship, and Sean talks about how people often confuse his wife for his mother, sister, or nurse, and what it's like to be in an interabled relationship. And I'm going to talk about 3 things. 1, spinal muscular atrophy in general. It's a very interesting genetic disease, and the revolutionary treatment he takes, Spinraza or nusinersen, and the controversy behind the treatment, particularly when it's used in adults like Sean, primarily because of its cost. It's about $375,000 per year, and it's used chronically. And then I'm going to talk about Sean himself, the type of SMA he has, what it affects, what organs does it affect, his cognitive function, his sexual function, what does the future hold for Sean? And thirdly, some people on YouTube seem to be skeptical of their relationship. They think it might even be fake. It may be a ruse to make money from YouTube, and I have a lot of experience with interabled couples, so I'll talk about that as well. So spinal muscular atrophy is a rare neuromuscular disease affecting approximately 1 in 10,000 people. And unlike other diseases such as cystic fibrosis, which affects primarily Europeans, or sickle cell anemia, which affects primarily people of African descent, SMA can occur in people of any ethnicity at roughly an equal rate. Now, this is an autosomal recessive disease. The genetics are very interesting. I won't be too technical, but autosomal recessive means that to get the disease, you need 2 copies of the abnormal gene, one from your mother and one from your father. 1 copy of the abnormal gene actually causes no symptoms whatsoever because 1 functional copy of the gene is sort of good enough for your muscles to function normally. However, if you have 1 abnormal copy, you're a carrier of the disease, and your children could potentially get the disease if you happen to mate with someone who is also coincidentally a carrier. Now, it's a little bit more complicated than that because there can also be new mutations in the gene, but primarily people get the disease because both their mother and father are carriers. Now, although the disease is rare, only about 1 in 10,000 people have it, being a carrier is actually pretty common. About 1 in 50 people are carriers of this disease. And in fact, many people are carriers of rare autosomal recessive diseases, and they don't even know it, and they'll never know it because they're unlikely to mate with someone who is a carrier of the same disease. Now, the genetics, as I said, are very interesting. SMA actually has some different causes, but the overwhelming majority, including Sean, their disease is caused by mutations in the gene SMN1. This stands for survival motor neuron 1. And this is the gene that produces a protein that is essential to the survival of motor neurons. These are neurons in the front of the spinal cord and brainstem that control the muscles. And they control all the skeletal muscles and the arms, limbs, and torso, and even the diaphragm, the muscle involved in breathing. And so the typical symptoms are progressive weakness of the muscles, and in severe forms it could even affect breathing. Now, it turns out that muscles such as the heart and the gastrointestinal tract are controlled by the autonomic nervous system and hence are not affected by this disease. That's different from other muscular diseases such as Duchenne's muscular dystrophy that directly affect muscles and can also affect the heart. So this is not a disease of the muscles, it's a disease of the motor neurons that secondarily causes muscle atrophy. Now, for people who have no function of the survival motor neuron protein whatsoever, they develop a very severe form of the disease that's sometimes called SMA0. Now, luckily, this is a rare form of spinal muscular atrophy, but it turns out this protein is absolutely essential for motor neuron function. And so when people have no meaningful function of the gene or protein, they have symptoms immediately at the time of birth. And in fact, mothers who have a baby with this condition also notice decreased fetal movement many times. And so the baby can have severely low muscle tone and even breathing problems immediately at birth. And unfortunately, these babies tend not to do well at all. Now, luckily, that's the minority. So why don't all people with spinal muscular atrophy have this form of the disease? There's tremendous clinical variability. Some people develop minor, slowly progressive symptoms in adulthood. I could actually still have spinal muscular atrophy, even if I have the same mutations in my gene that Sean has. Why is that? Well, it turns out there's another gene. In addition to SMN1, there's sort of a backup gene called SMN2, survival motor neuron 2. Now, this gene isn't quite as functional as SMN1. It doesn't produce as much of the viable protein. However, it does produce some. And people often have multiple copies, usually 2 to 4 copies, sometimes even more than 4 copies. And it turns out the more copies of the gene you have, on the average, you tend to have less severe spinal muscular atrophy. So the actual types of spinal muscular atrophy, SMA 0, 1, 2, 3, 4, and some people will use the term SMA 4 plus or SMA 5 to refer to late onset mild spinal muscular atrophy, these subtypes are defined clinically. So by definition, SMA 0 means symptoms are present at birth. SMA 1 is sort of the classic infantile form, which means that the person with the disease never achieves the milestone of sitting. They're never able to sit up independently. So usually this is diagnosed pretty early on, like within 2 or 3 months, because there's low muscle tone pretty early on. What Sean has is known as SMA2. So his story is that he was kind of normal at birth, and he was able to sit up independently later on. Typically, infants achieve sitting at about age 6 months. But at maybe at age 9 months, his parents noticed something was wrong. He wasn't able to crawl, and he had a little bit less mobility. A lot of children aren't able to crawl at 9 months anyways, but they must have noticed something was abnormal, and he was later evaluated and diagnosed with spinal muscular atrophy. But he was never able to walk. Early on in life, he had pretty good function of his upper extremities. He was able to swallow well, and he was able to feed himself. Later on in life, as the disease progressed, he was losing weight, and he had to get a gastric feeding tube. And because of decreased use of his arms, he was no longer able to feed himself. But he still has some function of the arms and is able to operate an electric wheelchair even to this day. So he has symptoms typical of spinal muscular atrophy type 2. There are milder forms of the disease as well. So spinal muscular atrophy type 3 is the form where walking is achieved, and the disease is milder and more slowly progressive. And then some people have what's known as adult onset spinal muscular atrophy, SMA 4, where they don't develop symptoms until much later on. And typically that form of the disease is very slowly progressive. Primarily the legs are involved, and those people can live a long life and don't have any problems breathing. And there are people who have really late onset spinal muscular atrophy that's sometimes called SMA 4 plus or SMA 5. Now, we don't have a genetic test to tell you what type of spinal muscular atrophy you have. So that's a common misconception. But it turns out the number of SMN2 genes correlates with the type. And so what you're looking at is data from research studies on the percentage of people with different clinical forms of spinal muscular atrophy and the number of copies of the SMN2 gene that they have. And you can see people with spinal muscular atrophy type 1, most of them have 2 copies of the SMN1 gene. And then people with SMA type 2, most of them have 3 copies, but it's not a perfect correlation. And the reason for that, of course, is there are many other genes that affect the growth of motor neurons, and of course there could be environmental factors as well. So let's move on to talking about Sean himself. And just to be clear, I don't know Sean, I'm not his doctor. The only thing I know is what is publicly available information. I did email him asking if I could make this video, and he did not respond, though of course I'm happy to take it down if it's somehow offensive, but I seriously doubt that given how public he is about everything. So anyways, we can all see that Sean has a lot of weakness and muscle atrophy. He doesn't seem to have any movement of his legs and only has a little bit of use of his upper extremities and his hands. He also has a few other features we can readily see. One is that his speech is abnormal. He has a speech disorder known as dysarthria, which is slurred speech due to weakness of the muscles that produce speech, such as the larynx and also the lips and tongue.
Like, if you read the comments on any of our videos, you'll see a lot of messages that are like, what's wrong with his voice?
Yeah.
Why does he talk like that?
Uh-huh.
He does not have a language problem. Sometimes people hear an abnormal voice and they think that it's a sign of abnormally low intelligence, but obviously if you listen to the content of what Sean says, he has high intelligence. He's a very witty guy. He says a lot of intelligent things, and that's because people are using a heuristic where some neurological disorders affect both speech and intelligence, such as Down syndrome. But in his case, there is no effect on intelligence whatsoever. The other thing we can see are that he has what are known as contractures at the wrists, and what happens as the muscles become weaker, there's often dominance of the flexion muscles over the extensor muscles, and it can cause a flexion contraction, which is an orthopedic problem at the wrist, and it can actually be painful, and there are braces and other treatments for this type of problem. But I should also point out what SMA does not affect. SMA is solely a disease of the motor neurons. It does not affect any other organ. It does not affect the development of the brain, heart, kidneys, or liver. There can be some secondary consequences of muscle weakness, such as bed sores or clotting in the legs or pulmonary embolism, but it really doesn't directly cause any other problems. And so Sean has a totally unaffected intelligence and personality. Also, functions of the autonomic nervous system are not affected. For instance, the gastrointestinal tract is not affected, although people with neuromuscular diseases can sometimes get constipation because they're not as mobile. It does not affect the function of the stomach or intestines or the heart. It also does not affect sensation. Sean has totally normal sensory function, presumably. He actually reports that when his arms became too weak to scratch his head, it was somewhat annoying because he had to ask for more help for that sort of thing. It also does not affect sexual function. It does not affect sex drive or testosterone level or the ability to achieve erection or ejaculation. And Sean and Hannah get this question a lot, and they talk about it. Also, it does not affect his ability to father children, and believe it or not, even though it's a genetic disease, the probability of his children with Hannah having spinal muscular atrophy are very low. So as I said, this is an autosomal recessive disease where you need one copy of the abnormal gene from the father and from the mother. And of course, Sean has two copies, so his sperm cells would almost certainly have the abnormal copy in the SMN1 gene. However, Hannah did genetic testing, and she is not a carrier for the abnormal gene, and hence their children have a very, very low risk. Unfortunately, it's not 0%. They actually talked to a genetic counselor, and they were quoted at a risk of approximately 1 in 1,700, and that's probably due to the fact that genetic testing isn't perfect. There could be some rare genetic mutations in the SMN1 gene that cause a non-functional protein that we are not able to detect, and also it's possible that Hannah could have a new mutation in her egg cells. So there is a risk, but it's very, very low. Now let's talk about Sean's treatment. So throughout Sean's life, he unfortunately describes that he has had progressive worsening and loss of his function. But at age 25, he started a revolutionary new drug, Spinraza, or nusinersen. And since that time, he states that he has stopped progressing. He is not getting better, but he is stable, which is awesome. So nusinersen is a very unique drug, and it's the first ever drug to treat spinal muscular atrophy. And the way that it works is it increases the amount of functional SMN protein that you get from the SMN2 gene. So remember, Sean does not have a functional SMN1 gene, but he does have an SMN2 gene. I don't know how many copies he has. And this drug, nusinersen, is a very unique drug called an antisense oligonucleotide, which essentially biases the transcription of the messenger RNA of the SMN2 gene. So in other words, to put it in layperson's term, you get more functional protein from the SMN2 gene, and some people have said it sort of essentially turns the SMN2 gene into an SMN1 gene. Now, the way the drug is given is it's given intrathecally, which means directly into the fluid around the spinal cord, and it's given once every 4 months. And it's a very, very expensive drug. The first year of treatment costs approximately $750,000, and after that it costs $375,000 per year, and someone like Sean could live to 100, so it's exorbitantly expensive. Now, there's a little bit of controversy, as I said, and I'll explain what I mean by that. Now, first, let me just say that I think there's a common misconception that Someone like Sean doesn't have anything to benefit from the drug because he already has significant disability, but he actually has a lot of residual function. So he can still operate a motorized wheelchair. He can still breathe independently. The diaphragm is very strong relative to the light weight of the lungs. So even though the diaphragm is affected by the disease, often you can still breathe independently unless the disease is very advanced. And he could potentially, untreated, get worse over time and lose his ability to operate a motorized wheelchair, lose his ability to speak clearly, and even lose his ability to breathe independently, which could ultimately lead him to die of complications such as pneumonia. So it's actually very, very important for Sean to preserve his function because his quality of life would decline dramatically if he lost any of those functions. You can surely all agree. However, for adults like Sean to be taking the drug is a little bit controversial, and I'll tell you why. One is that the drug is really proven when it's studied in infancy. The clinical trials of nusinersen are incredible. The benefit versus the placebo group was just out of this world, and there are children, no doubt, who would have had severe neuromuscular weakness who actually are able to walk independently. So it really can be a life-changing drug, but it's really best given early because it prevents the death of spinal motor neurons. It doesn't cause them to regenerate, and so when given later, it's definitely less beneficial. There's no doubt about that. And so some countries have actually refused to cover the drug for adults. They're only covering it for infants and young children or people with certain types of spinal muscular atrophy. So it's very controversial, but luckily Sean is able to get the drug and is stable. Many have also said the drug is too expensive. It should be much cheaper so that everyone will be able to have access to it, but I won't get into the technicalities of that. So the last thing I want to talk about is the accusation that Squirmy and Grubs is fake, that it's all a ruse, it's all designed to get views and to make money on YouTube. And I think some people just find it very hard to believe that someone with a significant motor disability like Sean would be able to find love and have a wife and have children and have such a good life. They think it's just too good to be true.
These guys this can't be real. This can't be real. Like, these people have absolutely no chemistry at all whatsoever. There's just nothing there. They have a relationship that's almost like she's taking care of her little brother.
Now, I'll talk about a few things. One thing I would say is that Sean is awesome. Like, he's very intelligent, he's funny and witty, he's written multiple books, he does public speaking and other things and advocacy. And he just has that positive attitude where he's not feeling sorry for himself. He's trying to enjoy life despite his disabilities. And he even said that even if he had a child with SMA, he wouldn't be devastated by it because he lives a good life with SMA. Why couldn't his child with SMA also live a good, positive, enjoyable life? So you can kind of see how someone would be attracted to Sean. Not everyone, maybe, but some people. Now, the other thing is, some people who don't have a lot of experience or knowledge of YouTube may not understand the idea that it's actually really hard to make a lot of money on YouTube. The overwhelming majority of people, even if they make good quality videos, don't actually make enough to make a full-time living on YouTube. So the idea that someone would create a fake marriage just to make money on YouTube is completely absurd. It would be very difficult for them to fake this forever because Sean is so distinctive, someone would likely out them anyways eventually. And also, people on YouTube don't make as much money as you think. If you look up on Social Blade, their estimated income, it's between $6,000 and $90,000 a year, which isn't that much. They may, of course, make a little bit more from that, from books and public speaking and direct endorsements and affiliate marketing, but probably not that much. I would imagine Hannah could make a lot more money if she just got a full-time job or married someone rich. They're just easier ways to make money and more sure ways to make money than to fake a marriage and make YouTube videos. I can guarantee you that. Now, I'm a doctor. I treat a lot of people with neurological diseases. I treat a lot of multiple sclerosis, which affects younger people. And so I have a lot of experience with interabled relationships. And I would just say it's really not uncommon for a married couple to involve one person with a significant disability and another person with no disability. I see it all the time. It's very common, and generally speaking, people are loyal and happy, and they love their disabled spouses most of the time. Now, there, of course, is some evidence that Someone's disability, if acquired later, can put a lot of strain on the relationship. And there is a little bit of a higher rate of divorce in people with acquired disabilities because life was different than people thought it was going to be. But Hannah really knew what she was getting into. And I think the fact that they met online really has a lot to do with the nature of their relationship. So it turns out that they sort of met online. Hannah found out about Sean, and they were kind of conversing by video chat. And they sort of fell in love with each other before they even met in person. And also, Hannah is probably a unique type of person. So there's a famous author named Gary Chapman who talks about the different love languages. In other words, the different things that make people feel love, and everyone's a little bit different. So some people, receiving gifts is a sign of love. For other people, physical affection is very important. For other people, acts of service or acts around the household are very important, like doing the chores, taking care of the children, cooking, cleaning. And of course, Sean can't do a lot of those things. But some people have different love languages. For some people, words are of affection, compliments, talking, that kind of thing. Emotional support is very important. And of course, Sean can deliver that just as well as someone without SMA. Another thing is quality time. Some people want to spend quality time with their partner. They want to watch movies together. They want to read books together. They want to talk together. They want to go out and hike together or do other enjoyable things together. And Sean, even with his disabilities, can still spend quality of time with Hannah. So I would suspect that Hannah is the type of person who has those primarily love languages that Sean is able to fulfill, and so that she's still happy, and they're both happy in their relationship. Anyways, definitely check out their channel. I'll put in the link in the description below, and if you have any other thoughts, please make a note in the comments below.